Hi everyone, this is Neel Raithatha, consultant audiologist and director of Clearwax. Thank you for joining me in my latest video using the iClearScope endoscope. And here we have a patient who attended with bilateral fully occluding earwax. And I'm starting off by treating their right ear. This is the ear that they reported symptoms in. And that's despite their left ear being completely blocked also, but they were asymptomatic in their left ear until I managed to clear this right ear. It's only then that they noticed that they weren't hearing so well from what they perceived to be their normal ear, when in fact it was just their better ear of the two. Now, this patient's earwax consistency can make it very difficult to remove, and they've got this consistency of earwax for a couple of reasons now. Firstly, they had been using some softening drops, some olive oil drops for a couple of weeks prior to attending, and it's something that I normally advise against my patients from doing, because there's always a risk that the patient over uses the drops, and if they put too much drops in, it makes the wax too glutinous, soft and mushy. The patient may already have wet earwax, so typically we either have wet or dry earwax, and the type of earwax that you produce is all down to a singular genetic mutation, which I'll try and talk about if I get time later on in the video. So if you've already got soft wax, by putting drops in, you're further softening something that's already soft, which makes it more difficult for me to remove. But I think a big factor as to why this patient's got quite mushy wax is because they suffer from chronic inflammation. The next time I come out the end, re-enter it, just keep an eye out at the entrance in particular. You'll see the canal wall, it's quite inflamed, it's a bit swollen even. And patients who suffer from chronic inflammation of the ear canal are more prone to developing skin. So skin formation and synthesis in the ear and other parts of the body is fueled by blood flow. The more blood flow you have, the more skin that's secreted and formulated. The more skin that your ear creates, eventually, you may have just seen that as I entered, it was quite red and inflamed, so I should have pointed it out. So the more skin that your ears produce, eventually the more dead skin that you're going to have accumulating in the ear. And when you've got a high turnover of dead skin, it can become quite mushy. So there's probably several reasons why this patient has got this consistency of wax. So in future, I've advised them against using any drops. They've already been seen by ENT in relation to their chronic inflammation. They used to also suffer from chronic active infections, so the ears used to always be discharging and weeping, but that's got under control. Although that's under control, they're still getting this inflammation and buildup of dead skin and wax, which out of the two, if you have an option with wax and dead skin formation in comparison to having an infected ear, obviously it's a better outcome for the patient, but it just means that they need their ears cleaning on a regular basis. I'm just trying to remove the skin and wax from a region of the ear called the anterior recess. It's a very difficult, hard to access region of the ear. So as we approach the eardrum, the ear canal narrows, and about 0.5 centimetre away from the eardrum, the ear canal then widens again, and it widens normally more so on the front section of the ear canal, so the anterior canal wall, which is the side where adjacent to the suction probe here. And it also widens at the floor of the ear canal towards the eardrum, so it kind of creates almost a trench or a basin. And they're two hot spots for wax and dead skin formation. Well, I would say skin formation. Wax, traditional wax, is normally secreted on the outer third of the ear canal. Whenever you've got debris, wax or dead skin deep in the ear, it can either be pushed by the patient, so it's self-inflicted using a Q-tip, cotton bud, or inadvertently, so a lot of patients wear hearing aids or ear defenders, it can push that. So if it's pure wax, traditional wax, so 60% earwax, dead skin, 40% sebum and the oily sweat that our ears produce, then you would assume that's been pushed in. If it's a lot of dead skin formation in the ear canal, then I wouldn't say that's self-inflicted. I would say that's due to a skin condition like this patient has got, and so all this inflammation. And so, and that's because the skin is actually synthesized at the center of the eardrum. There's a place on the eardrum called the umbo. So where the hammer bone, so I don't know if this can go back to front because the way I'm recording, I think it will. So I'll try and accommodate for that. But you've got your eardrum on screen here, then you've got your hammer bone. And hopefully I've got that the right way, because obviously when I put it onto the video, it's going to be back to front. The hammer bone in the middle, it attaches itself to the eardrum. We call that the umbo. That's the progenitor site for skin synthesis in the ear. So the skin that lines the entire ear canal, well, at least the inner 2/3, the bony portion of the ear canal, it once upon a time originated from the center of the eardrum. And so when skin cells are formed at the center of the eardrum, they slowly radially migrate, almost like when you drop a pebble in a pond or a puddle and you get the ripple effects. Imagine those ripples being skin, and that skin, it then spreads off radially from the center of the eardrum. It then lines the ear canal, and the skin in the ear has evolved to laterally migrate. It's like a conveyor belt. That's the ear's mechanism of self-cleansing itself. If the ear wasn't able to shed itself of the dead skin, then our ears would be chronically blocked with dead skin when it would require regular cleaning. So dead skin, any other part of the body, as it dies and sheds, it falls off and separates itself by the body. That could be when you're having a shower, it could be when you put your clothes on, so friction, the skin just falls off and it goes to the floor. That same mechanism wouldn't work in the ear, because if that skin just separates itself from the canal wall, it's just going to fall into the canal and accumulate. So the ear has developed this natural conveyor belt, if you like. So old skin is replaced by new skin in this continuous cycle. And that kind of conveyor belt of skin that I've just described, that's also the ear's way of expelling excess earwax out of the ear. So earwax should be sitting on the surface of the skin, and as this conveyor belt motion it's operating, it transports anything sitting on the surface like earwax. This epithelial migration, lateral epithelial migration, that's what we call this conveyor belt motion. It works for the majority of the population, 90 to 95%. However, in a small minority of patients, it doesn't. Now, 5 or 10% of the population may not seem a lot, but in the UK, the population is it 70 million? So 10% of that is 7 million. So that's quite a lot of people in the UK alone that have the potential, based on the percentages I just provided, that suffer from earwax impaction, because the migration of skin doesn't operate, which means the wax is not being transported naturally out of the ear. So that's it. And if you think globally, it's 7 billion. So yeah, you can do the maths. It's a lot of people who worldwide may have cerominosis. So cerominosis is the medical term given to earwax impaction. So I'm just using the fine air and just mopping up at the bottom of the ear canal now. There is going to be some residual skin wax remaining in the ear. I have to stress, when we clean people's ears, the primary objective is to alleviate the patient of their symptoms. So patients' main symptoms are hearing loss, possibly pain, or a bit of tinnitus, ringing or buzzing noise in the ears. But leaving a bit of wax behind is not going to do anyone any harm, particularly the patient. In fact, if you try and over clean the ear, you can strip the ear of natural wax that you can't even see. It's a veneer that's lining the ear canal wall and the eardrum, and we want that. That's when most people with cotton buds, they often say that they don't have wax because they're cleaning their ears constantly and using a cotton bud, and they see it around the cotton wool. The probability is that they probably don't produce a lot of wax in the first instance, and that wax that's accumulated around the cotton wool is that veneer that's lining the ear canal, that protective layer, and you're scraping that away. And that veneer of wax is really important. So it's helping to hydrate the skin underneath that it's sitting on. It's a repellent to external water that may enter the ear, which can potentially lead to an infection and maceration of the skin, so has waterproof abilities. Earwax, this veneer, is slightly acidic, and the acidity helps to prevent more harmful bacteria. So remember, our ears are full of bacteria. Under normal conditions, these bacteria are completely harmless. They're non-pathogenic. And these skin flora bacteria, their optimal breeding conditions are a mildly acidic condition, but if you get water in the ear, it's going to increase the pH level, so it becomes more neutral and alkaline, and then you can get the rise of more pathogenic bacteria, which are neutrophilic. Their optimal breeding grounds are when the pH is more neutral or alkaline. So the wax helps to repel that water. And also earwax is naturally sticky, so only foreign particles, dust, dirt, pollen, insects even, that may enter the ear, sticks to the wax, and as described, the wax naturally comes out of the ear. So we're just going to have a look at the eardrum. So you can see there's a bit of skin at the bottom, but it's on the bony part. Decided to leave that. I don't want to graze that. There is a couple of hair strands as well in the eardrum, but wasn't the cause in the patient any symptoms, and I wasn't prepared to risk trying to remove that for no added benefit. And hopefully that'll just naturally migrate. Well, I hope you enjoyed that video, guys. Take care, keep well, and speak soon. Bye.